All right. Wonderful, wonderful. Thank you so much, Hannah. Hello, and welcome to another Rush Generations Health Education Lectures. Our Rush Generation staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, July 26th. I am Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture, Allergies, Asthma, and the Environment. And we have, as you see, we have a fabulous group of women offering valuable information to all of you today. But before I introduce these wonderful speakers, I'd like to first thank Kim Murley and Hannah Weitzman for helping with the production of this lecture. Hannah, actually, as always, will be helping us manage the chat and other key aspects so that we all can have a great discussion about these respiratory health conditions, as well as the impact of pollution and what we can do about it. So even some policy conversations happening today. As always, we're live streaming this lecture via our YouTube channel, where we have dozens of other health education lectures that you can always refer back to or send to friends, families, colleagues that you think will benefit from the information that we provide. We use the video platform Zoom, which also allow us to host a good number of people who join us via phone. But for those of you on YouTube, we ask that you please use the chat function to ask questions, to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to today's presenters. And for those of you listening to the discussion via phone, you will also have an opportunity at the end to unmute your audio so that you can ask your questions. So thank you so much for joining us. We'd like to remind you that all the information that we offer here, especially around health and treatment options, is general information for general information purposes only, and to always seek additional professional advice for situations that are specific to you and your needs. But without further ado, I'd like to start introducing our speakers for today. Let's see, we have first Renee Bergholt. She has been a respiratory therapist for more than 30 years. Renee is currently the pulmonary function laboratory testing manager here at Rush University Medical Center. Educating patients and family members is a very important topic for her, and she's honored to be able to share her knowledge with others. Renee is hopeful that through actions and education, she can make a difference in someone's life. I can relate to that. So thank you for joining us, Renee. Then we have Dr. Ellen Stephen. First, Dr. Stephen, let's see the slide. We have one slide with her. Fabulous, thank you. First studied biology at Dartmouth College and then graduated from the University of Chicago's Pritzker School of Medicine. She stayed at the University of Chicago for her residency training in internal medicine, and then came to us, to Rush, for fellowship training in allergy and immunology. Dr. Stephen's research interests focus on understanding healthcare disparities in allergic diseases and studying the positive impacts of penicillin allergy testing. We'll have her speak first, then followed by Renee, and then we'll have Kelly Nichols, who is the Senior Manager for Policy and Advocacy at the Respiratory Health Association. Ms. Nichols has worked in advocacy and activism for 8 years, and before beginning her current position, she was the Illinois director and then the Midwest director for the National Climate Action Group called Moms Clean Air Force. I love it. She worked to build connections with stakeholders, community members, coalitions, and other nonprofits throughout the Midwest to move forward climate action. Not only did she coordinate collaborative efforts between state-level engagement and national campaigns, Ms. Nichols also worked closely with environmental justice groups in her region to support environmental equity in policy. So thank you so much to the three of you for being with us today, and for all of our Rush Generations members. Let's make sure that we start by sharing. Dr. Stephen will share her slides. Let's see. And then we have you start the video as well. All right, take it away.
Good afternoon, everyone. Thank you very much for the opportunity to present today. And I'm excited to start us off by talking a little bit about allergies, with a key focus on environmental allergies, because as you just heard, that will definitely play into our conversations about asthma and the environment that follow. All right. So just a brief overview. First, we'll talk a little bit about how to recognize allergic rhinitis. Then we'll talk about other common causes of similar nasal symptoms that might seem like allergies. Then we'll move into talking about treatment options. And I'll give a brief introduction, since I am an allergist more broadly, about other allergies that might affect you, although these won't be as relevant to the rest of the presentations today. And then I will just summarize some resources that you might want to consult about allergies. So first, how do we recognize allergic rhinitis, which is also known as environmental allergies? Rhinitis is a fancy term really just meaning inflammation inside the nose, inflammation of those nasal tissues. And the symptoms that you might experience from this condition would include stuffy nose, nasal congestion, or some runny nose, maybe some mucus dripping down the back of the throat, which we also call postnasal drip. Some symptoms that are part of allergic rhinitis are a little bit more specific for environmental allergies. These would be itching, especially if you're itching your eyes, nose, or ears, if you're having sneezing, or if you notice there's a seasonal pattern to your symptoms, they really only bother you in the spring, fall, or both. These could be signs of pollen allergies. What are some different triggers of this allergic inflammation? Inside the home, there can be a variety of triggers, especially dust mites, which really live everywhere that humans live, even if the home is very clean. Also, cat and dog, they do carry allergen, and not just in their dander, but also can be in the saliva or in the urine. Cockroach can also be common, especially here in the city of Chicago. Outside the home, you might experience tree, grass, or weed pollen reactions, or molds could also be a common trigger for these symptoms. In terms of identifying environmental allergies, first of all, we know that environmental allergies do affect a lot of people. We know that about a third, 1 in 3 adults over the age of 54 will report nasal and eye symptoms that could be allergies. And about 1 in 3 of those people will then test positive for allergy triggers when they get allergy testing. So in this box here on the side, should you see an allergist or a sinus specialist? If you're noticing some of these symptoms, especially with a seasonal pattern or with exposure to cats or dogs, allergists can be helpful. They can do skin testing or blood testing to determine what those triggers might be for you. And there are several symptoms when it comes to the nose that really should not be ignored. One would be a complete loss of smell and taste, which did come to our attention a lot during the COVID-19 pandemic. But if this is a long-term problem for you, that is a sign you might need an ear, nose, and throat doctor evaluation. Or if there's clear fluids dripping from just one nostril, or if you have severe pain in the forehead or the face, these could be signs of a more extensive sinus problem beyond just allergies. And on that note, what other things could really cause these symptoms besides allergies? That's just important to keep in mind as well. So not everything that sniffles is allergy, although a lot of it is, as we mentioned. So other causes could be non-allergic rhinitis. This is very common, especially in older adults, and it can be triggered by cold air, odors, perfumes, smoke exposure, which has been very relevant recently in our city, pollution, or exercise. And there's also a phenomenon of gustatory rhinitis, big word meaning that spicy foods really trigger a stuffy and runny nose. And then there's another phenomenon of atrophic rhinitis. This means as we get older, really the blood flow to the nose and to those nasal tissues can drop. And this can lead to thinning out of the tissue inside the nose. So you might notice crusting, dryness inside the nose. And interestingly, even though it's more thin inside, you actually feel more congested. Also, very relevant is that many common medications used for blood pressure, hormonal treatments, enlarged prostate, erectile dysfunction, these could all actually have associated with them rhinitis or inflammation inside the nose that would cause these nasal symptoms. In addition, Afrin is a common over-the-counter medicine for nasal congestion. When you use a lot of Afrin, it can actually lead to a rebound where when you stop, your nose feels even more congested than it did before. So these are all important causes to keep in mind. And there's other conditions that your doctor would look for, autoimmune diseases, cancers, or CSF leaks. These are hopefully very rare in this case, but something else just for your doctors to keep in mind. Treatment options, as far as making the nose and the eyes feel better, is going to be very important when it comes to allergies. First of all, avoidance is key. If you have allergies, the number one step is to keep your exposure to your allergy triggers as low as possible. So we have various ways to do this. One can be to put dust mite protective covers on the mattress and the pillows. HEPA filters will also be important. You can have a portable HEPA filter inside the home. It can be built into the central air system, or it can be part of a vacuum. And all of these can help keep allergen levels low. Keeping cats or dogs out of the bedroom and out of areas where you spend a lot of time inside the home is important, because once the allergen gets in the air, you'll be breathing it in when you spend a lot of time in that room. If you have outdoor allergies to pollens or molds, when you come in from being outside for a long time, definitely shower off and change your clothes immediately so that the pollen doesn't stick with you any longer. And certainly, these precautions can be taken no matter where you live. So just make sure that you speak with doctors, meet with an allergist, and they can provide documentation to help your living facility make some accommodations to decrease allergen exposure. A lot of allergy medicines that are used to treat the symptoms are over the counter, but we do recommend under doctor's advice, consulting with a doctor whenever there's any questions. And our first step in treatment is always a nasal spray. Steroid nasal sprays are very helpful. Flonase is a very common one that you might encounter. These sprays can really decrease itchiness, stuffiness, and mucus production inside the nose, but they may cause some dryness, bleeding, or crusting. And we also often use antihistamine sprays. Astapro or azolastine is now available over the counter, and it works really well in combination with Flonase. And interestingly, both of these medicines will help for those who have allergy triggers and those who have non-allergic inflammation in the nose too. And this picture here demonstrates that it's really important when using a nose spray not to spray it straight back in the nose, but rather tilt the tip of the sprayer outward a little bit toward the eye before spraying, because then it won't irritate the middle of your nose, and it also will work a little bit better when it's aimed at that angle. In addition, there are oral medications, pills for allergies. You may have heard of Allegra, Zyrtec, Benadryl. Certainly we would say avoid Benadryl. There are numerous side effects with that could cause bigger problems, but use newer options, Allegra, Zyrtec, Xyzal. These are generally quite effective, and the Allegra and Xyzal specifically are not drowsy, so they should really not interfere with your day-to-day. If you do have kidney disease, please do consult your regular doctor, primary care physician for dosing recommendations on these medications. And be aware that if you go into a standard pharmacy, these drugs may have a very high price tag. But if you look at alternate sources like Costco, Sam's Club, or Amazon, you may be able to get a large supply of these medicines for a much more affordable price. One other thing to note is allergy shots, which you may have heard about. Basically, this is our number one way to modify how your body responds to its allergy triggers. So we also call this allergen immunotherapy, or IT, and often it's given as injections, actual shots, in the allergist office, once a week and then once a month after you reach a maintenance dose. But there's also a sublingual option, meaning a tablet that can be put under the tongue at home. And this is available if you have only one allergy trigger, and it would be dust mite, grass, or ragweed. You could consider doing an oral treatment for that. This is a large time commitment for sure, and there is a risk of reacting because we're introducing your body to something that it's allergic to. So the allergist really has to supervise this sort of treatment, but it really can get to the root of the allergy symptoms and decrease the need for medications in a lot of cases. And it would be a one-on-one discussion whether this would be safe with other medical conditions that you might be facing. So that talks a little bit about treatment and our approach to environmental allergies. So we've talked a little bit about how to recognize them, what else might be causing your nasal or eye symptoms, and how to use medications and avoidance to your benefit. Briefly, I'm just going to touch on other allergies that might affect you, just so you would know you could seek further medical attention for these. First, we hear a lot that this food doesn't sit well with me. This food really doesn't agree with me. And people wonder, is this a food allergy? So a food allergy is a very specific immune reaction to eating a food where you get immediate symptoms, usually within minutes to a few hours after eating. Commonly, this occurs with milk, egg, wheat, soy, peanut, tree nuts, fish, or shellfish. Usually you would see symptoms like hives, swelling of the face or throat, trouble breathing, immediate vomiting, or even passing out in extreme cases. In order to treat severe reactions, EpiPens are required, injections of epinephrine, to treat anaphylaxis, which is the name for that very severe reaction. Usually, this would not be a concern that arose when you were an adult. This would typically be first noticed early in your life after first trying that food. You'd have to be introduced to it a few times to develop the allergy, but then you would start having reactions at quite a young age. However, if you have experienced any of this, definitely important to see an allergist. They can test the skin or the blood to confirm if this really is a food allergy. And otherwise, there are a lot of different food reactions. These can include intolerances and sensitivities, but we don't understand the mechanism of those reactions as well, and we don't have any validated tests for them. So really, avoidance of the culprit foods is important. Using a food diary to keep track of which foods were eaten before the bothersome symptoms started can be helpful to figure out which foods need to be avoided. And the other category of allergies that we see a lot in our office is drug allergies, medication reactions. So these are also very important to clarify because it really will affect your future treatment options. And one type of drug allergy is the immediate type. This is the anaphylactic type of reaction. Again, you'd be looking for those same severe symptoms occurring within minutes to a few hours after taking the medication dose. And again, you'd have to have had the drug before, and now you're trying it again, and now you're reacting to it in that way. And we can help try to confirm these reactions for you. We do a lot of penicillin allergy testing, which is an area of my own interest. And about 10% of people report a penicillin allergy or it's on their chart. But what we know is that if it's been more than 10 years since that reaction or since that allergy label got placed on your chart, about 80% or more of people, 8 in every 10 people, will test negative with skin tests and oral tests in our office. And then they can start using these antibiotics again. And usually these are really good antibiotics for treating infections without as many side effects. So really important to get that penicillin allergy evaluated. There can also be delayed reactions to medications, a rash that comes on a few days later that's not hives, but still might be itchy or red. Sometimes these can be severe. Definitely if you start having fevers, confusion, feeling very tired, or just feeling unwell after you've started a new medication, please do seek medical attention right away to make sure that's not a severe drug reaction. And overall, that's really what I wanted to share with you today about allergies. We have several great resources online. Several of our organizations at the national level do put out a lot of information if you wanted to read more. And of course, definitely please come see the allergy department here at Rush. You could talk to your primary care provider about that and get a referral, or we can also be reached directly at the following phone number. So thank you all very much for your time.
Thank you, Dr. Stephen. Thank you so much. Before we have then Renee join us, just a quick question, because we know that you mentioned the allergy to penicillin. All of a sudden, then you're no longer allergic, and does that happens as well, I imagine, with those individuals that never had allergies, or if they had allergies after several months, then they don't have those environmental allergies as well. After
That's a great question, definitely. Interesting thing about environmental allergies, they can arise at any age. So it's not necessarily that it's going to arise when you're a child, like the food allergies typically do. But once you develop environmental allergies, at least in your particular area where you live, usually those will stick with you. Sometimes they get less severe over time, or more likely you figure out how to avoid your triggers and use the medications. But
of course,
usually once they come on, they will stick. So a little bit different than penicillin.
That's fantastic. Let's read the phone number again, just in case. We can read it later, but it's 942-312-942-6296 for the to contact your office. All right, we will give a chance to more people continue to pose questions in the YouTube channel and all of that. So we'll have Dr. Stephen join us at the end during the Q&A. Let's have Renee Berthold. Am I saying your name correctly, Renee? Sorry, your last name.
You are.
Okay.
Yeah, Berthold it is.
Berthold, thank you. I think that we have, you're perfect. Thank you, Hannah.
Thank you, Hannah. Hi, I'm Renee, and I appreciate the opportunity to talk to everyone today. Your lung health is very important to me. As a respiratory therapist, my goal is and know what to do when their asthma is acting up, whether it's yourself or your grandchildren, or you happen to be somewhere. So I take asthma very seriously, and I hope you will too. So we're just going to go over today some asthma awareness, like signs and symptoms. Some people might not have a full understanding of asthma, and I'd like to help clear that up a little bit. I'd like to discuss what happens inside your lungs when the asthma is occurring and prior to an asthma attack. I'd also like to discuss some prevention and control of your asthma episodes, things that you can do to help yourself from having asthma issues. And we want to discuss the monitoring and the treatment of the symptoms of your asthma and what you do, how do you treat your symptoms, and when is it important to get help. So asthma is a lung disease. And what it is asthma is a problem that is both medical and physical. It does require treatment, and sometimes it requires emergent treatment. And that's really what I'm here for. As a respiratory therapist, I know that time is critical when you can't breathe. And when you can't breathe, really nothing else matters. So it's not imagined or made up, and it's not something you can ignore. It's very serious, and it can be deadly if it's not taken seriously and action isn't taken when necessary. It used to be years ago, people would say, oh, asthma's, that's in your mind. You'll be fine. Just sit there and relax. That is not true. Your airways get inflamed. Things happen. The asthma won't just go away if you sit down and just rest. And something I found in all my years of experience is you can develop asthma later in life. A lot of people will say, oh, I had asthma as a child and I outgrew it. You never outgrow it. It just happens to kind of relax until something triggers it. And women can be perimenopausal and postmenopausal and develop asthma. So it can be a big problem for you. So I'd like to tell you what happens during asthma. So I have the two pictures up here for you. And with asthma, three things happen, and generally they happen all at the same time that make it really difficult to breathe. So you have a picture there of normal airways. They're nice and open. There's smooth muscle around the outside of it. That muscle is nice and relaxed, and those airways are clean. What happens during asthma is the airways become inflamed. You come in contact with something that your body doesn't agree with, and the airways start to react. So you get a little swelling inside the airway. So the inside of the airway becomes thicker and tighter, and then the muscle around the outside of the airway starts to clamp around those vessels and make it harder to breathe. So the opening becomes smaller, and along with that, your body starts to produce mucus as a reaction, so that further decreases the diameter of the airway that air is allowed to flow in and out of. So when the airways get tight and those muscles tighten around it, that's what we call a bronchospasm. So you may be walking along at the park or doing something a little more active than normal, especially now with this poor weather quality, and you find it's harder to breathe. Those are generally signs of that inflammation that's occurring in the airways. So should I worry about my asthma if it isn't bothering me? I hear this a lot in my profession. And what I tell people is you want to really keep track of what is going on, because asthma can happen very quickly. You come in contact with something that irritates your airways, and they get inflamed and swell up right away, and they bronchospasm, and you feel like you can't breathe. Up in the corner of my slide, I have those statistics. Those are from 2019. 250,000 people die prematurely worldwide every year due to asthma. So what happens to your air passages? They start to make you cough. So you come in contact, you walk in a room, you begin to cough, you can't catch your breath. They begin wheezing. You hear this faint little noise when you're breathing, and it sounds rather odd. You begin to feel short of breath when you're walking or moving, and sometimes even just sitting. And sometimes you'll have chest tightness where you're sitting and you feel like you can't take a deep breath. It almost feels as if someone's giving you a rather large bear hug, and you just can't take that deep breath in. Your airways become very tight and uncomfortable. And you get the impression that it just doesn't seem normal. You should question that. So if you take medications, it's better. If you don't take these medications, what happens is you say, well, my airways are a little stiff. They don't feel so great. I'll just sit down and let it get better. They still have inflammation in those airway passages that doesn't completely reverse itself and open up. So over time, the inflammation gets worse and worse and worse. And this will cause your asthma symptoms to become worse because you're leaving them untreated. So the American Lung Association has an asthma management plan, which I really strongly suggest that you work with your physician to create one for you. So what you want to do is figure out, you want to work closely with your doctor, because you don't want to put yourself into a position where you come into something that irritates your airways and cause an asthma attack. But you want to kind of keep track of what's happening. You know, were you making the bed? Were you vacuuming? Were you at someone's house and their pet was nearby? Did you walk into a room with cigarette smoke and it began to bother you? And then you wonder, a lot of times people will have asthma flare-ups when they catch a cold or an infection. You begin to cough up some phlegm and you figure it's just the cold, but your airways become more reactive because you have that cold. So you want to keep track of those items. So it's very important to know what your triggers are and to take your asthma medications as prescribed by your physician. In a few minutes, I'll go over the medications with you. But if you can track your asthma signs and recognize early what your warning signs are, it's very helpful for you to make sure you know when to get help and when you need to take your medication, your relief medication. You want to make sure that if you're going to be out and about and you've had a reaction, that you keep your medications with you. And you want to know what to do when your asthma is getting worse, opposed to just sitting down and saying, well, I'll wait till my son gets home from work, or I'll wait till my friend comes over and I'll see what they think. It's very important to be proactive in your own care for your asthma. And the American Lung Association's asthma management plan is a great item. So a lot of people will either monitor their symptoms or they will monitor their peak flow values. So we have varying items. So this is the asthma action plan. And what it tells you is you're going to get a peak flow meter and you're going to measure your values. And then you're going to figure out what 80% of your normal value is. And if you monitor by the peak flow, you just do this daily for several weeks so you know what your values are. And then you set little markers on this device and you do this peak flow in the morning and see how you look. And if everything is in the green, that's great. Go along, have a nice day. Everything looks wonderful. You've been doing it and it's in the green, and then it starts to get into the yellow. You're starting to have some coughing and some wheezing, especially with the air quality we're having right now. Then you want to maybe keep a really close eye on that. So your numbers begin to dip. And once they dip a little bit, you want to make sure that you keep in touch with your doctor. If your peak flow drops between 50, down from 100 down to 50%, within 24 hours, you want to contact your doctor. You want to make sure that you're doing what you need to do. And your physician may very well tell you to come in for an appointment, tell you to take different medications, but you want to really keep a close eye on it. If you're using that peak flow meter daily and you find that your values are dropping and you're in the red zone when you got up this morning, you need to call your doctor immediately. And if your airways feel very tight, you need to call 911. You do not want to sit around and just wait for something to happen. Asthma happens very quickly, and you don't have time to drive yourself to the hospital. My suggestion as a respiratory therapist is to always carry your quick relief inhaler with you. It is a fast-acting bronchodilator that will open up your airways within 15 seconds. So the measurement of the peak flow, as I was saying, this is typically what one of those little devices look like. And it's just a little plastic device. And all you do is you blow as hard and as fast as you can in it. And you register those for 2 to 3 weeks at the same time every day. So take it first thing in the morning and blow, and then try it again in 2, especially if your physician has you on medications. You want to figure out what your normal numbers are so you can keep track of those values. And then you're going to just monitor when you blow, the little disc inside will go up, should go up to your green zone, and everything is good. So it's the same asthma care plan we saw on the other side. This is just showing you how the device looks. And again, if you're in the red zone, you need to call your doctor right away. Once you hit the yellow zone, if you hit the yellow zone for one day and it goes back to normal, that's okay. I would document that so you can see how often you're going into the yellow zone. But if you've been in the yellow zone for more than 24 hours and it isn't getting better, definitely contact your physician. If you're in the red zone, please seek medical attention. Okay. So this asthma treatment plan is a really nice device, and you can work on this with your physician. I highly recommend it, and it's very simple to do. It's the same as the little sheet that we just looked at, but how it's going to help you is you're going to do that journal and write down what causes your asthma to act worse, what causes you trouble, what brings it on, and there are certain triggers to avoid, as Dr. Ellen mentioned. So the dust mites are huge for irritating people's asthma. So if you can protect the pillow covers, the mattress covers, make sure that pets are kept out of the bedroom. A lot of times, people will have the cat sleeping on their bed, and all that cat dander really can aggravate your asthma. So that's part of your treatment plan, is to try to avoid the triggers. If it's vacuuming, see if somebody else can vacuum for you. See if there's different things you can do. HEPA filters are wonderful to help filter out that dust from your rooms. You want to monitor those peak flow symptoms. Again, seek help if your flows drop for 24 hours. If you're in the yellow zone for 24 hours, seek help. But if you are in the red zone with that peak flow meter, please seek help immediately. Don't wait until you feel better, call 911, because if your airways close off, it happens really fast. If you feel extremely short of breath, we don't recommend that you drive to the hospital, call an ambulance, or before it gets that serious, have someone drive you to the physician's office. But if you take your medication as prescribed, There is emergency inhalers and what we call controller or maintenance medications. So, and your doctor will explain to you, the maintenance medications are designed to decrease the inflammation and the swelling in your airways so that you will have less and less reactivity going on. So if you take those as prescribed, which is usually every 12 hours, every day, it takes a couple of weeks for those to build up enough of a level in your bloodstream to start reducing that inflammation and swelling in the airways. You will need your emergency inhaler less and less. So it's very important to let your physician know if the medications are not working correctly for you. If you don't take them regularly, please don't pick them up and take the maintenance medications today and then take it again 3 days from now. You have to take it on the routine that they give you in order to reduce that inflammation and to keep your airways feeling better. You want to discuss all of those medications with your physician, and if you need to write them down, that's great. Write them down, jot it on the refrigerator. You know, the red one is for when I don't feel good. The blue one might be for every, morning and evening. Any way that makes it easier for you to keep track of them, we love. And ask questions to your physician about when to call and who to call if you're having trouble breathing. Make sure that you know when you need to go to the emergency room. Okay. So can I live comfortably with a diagnosis of asthma? Yes, you can. Asthma can be managed. It's similar to diabetes or high blood pressure. If you take your medication and you check your blood pressure regularly, you can keep track of what's going on, and you can live a nice, happy, comfortable life. Asthma doesn't go away, and it cannot be cured. It will always be there, but we can control the symptoms and manage the medications to make sure that you keep your asthma under control. A lot of people are having difficulty right now due to the poor air quality. It's triggering asthma in people who haven't had any problems in the last 30 years. And it's because your lungs are getting irritated. They're starting to react. So make sure that you keep that little diary and you discuss with your physician and you figure out what are your symptoms, the coughing, the wheezing. Do you have tightness in your chest? Do you get short of breath just sitting? Do you wake up in the middle of the night with shortness of breath? Are you taking your medications correctly? And please make sure you know when to get help. Asthma is very serious, and a lot of people don't really understand that, but when your airways all clamp off, it can be life-threatening. And, my goal as a respiratory therapist is to educate as many people as possible and to ensure that we are giving you all the tools so that you can lead a happy, healthy life and be able to do everything that everyone else can do while you have your asthma. Here are just some websites. This top one is the Chest Foundation. Those are links for the asthma, the goals there and the guidelines that I had, and different links to different articles and tests and great places to look for information. The American Lung Association is on there, so you can get all of those extra help that you might need. So I thank you for allowing me to speak. And if you have any questions, please feel free to reach out to me, or if you happen to be at Rush for something, please stop by and visit. Anytime you need any education or questions, we have lots of printed material you can take home as well.
Thank you so much, Renee. Actually, you've made me even think about some older adults, or actually even adults that have said, when I was a child, I was asked to, even though with the asthma, I was asked to play and run, and now it's gone. So it's not necessarily that it's gone, but even though they haven't had made symptoms probably for 30, 40 years, that was something interesting. So it's the tough it up, the message that they received when they were younger. I mean, they may have help with helping them live with it, but it's not necessarily that it is gone. So
yes, a lot of people are under the illusion that if you had asthma as a child, you grow out of it and it goes away. It never goes away. It just lays dormant until something triggers it. And that's one of the messages I like to carry, is that people do need to be aware if they had asthma as a child, it's never gone. You might be able to play sports. You might, you might be totally fine now, but with this poor air quality, a lot of people are coming forward who haven't had problems in years just because it's been consistent with this poor air quality, and the airways are starting to get irritated and inflamed.
Yeah, very good. And actually, for those of you that were not able to look at the chart that Renee was sharing, but it's pretty much like the traffic light. You have green, you are good. I mean, some problem breathing probably, but still you're good. Like it says there, enjoy your day. Yellow is, well, then you have to slow down or maybe reduce or be more cautious because there's some problems already being experienced. And red is when you probably need to call not only your doctor, but maybe even 911, right? That's when
Right.
there's lots of problems breathing. And the other thing that Renee showed us was the peak flow meter. And it reminded me, those blowout things that you use for happy birthdays. You blow into it, but this one has a meter to tell you in which zone you're at. So it's either green, yellow, or red. Fantastic.
Yes. And these are very inexpensive, and you can always ask your physician to get you one, and they can call one of the pulmonary departments and get you one for free. And I think they're $5 at CVS. So they're not very expensive, and it's an excellent tool to monitor your asthma.
Wonderful. All right. Well, thank you so much. I don't see questions yet, but at this point, we'll have then Kelly Nichols from the Respiratory Health Association join us.
Hi, thank you. I love these because I also learn from the people that I listen to. We all have our wheelhouses, and it's great listening to people who are deep in their wheelhouse and all the information they have, because I work with asthma, but from a policy and stuff standpoint. So hearing Renee talk about it is great, and hearing Ellen talk about allergies is awesome. I have a pretty severe sulfa allergy, so I'm wondering if it works the same as penicillin, but I'm not going to test it out because it's a pretty severe reaction. So I'll talk to my doctor and find out from them. So my name is Kelly Nichols. I'm going to do a presentation on the impacts of air pollution on lung health, kind of what Renee started to talk about. So I have a slideshow. I'm going to cue it up for everybody now. Let's see. Get it up. Hang on 1 second. Let me just minimize this guy. Okay. All right. Can everybody see my slides?
Yes, this is good.
Excellent. There you go. That's better.
Perfect.
Wonderful. So I'm going to start by talking a little bit about where I work. First of all, I'm Kelly Nichols. I'm the Senior Manager of Policy and Advocacy with Respiratory Health Association. And I primarily handle sort of the coalescence of all of the programs that we do at Respiratory Health Association through a policy lens and an advocacy lens. If you're connected to our organization at all and have ever gotten an email about advocacy, it's from me. So you might know me already if you have a connection to the organization. Respiratory Health Association is a Chicago-based nonprofit where we were established in 1906. And our mission is to prevent lung disease, promote clean air, and help people live better through education, research, and policy change. And our primary focuses are asthma, tobacco cessation and tobacco use, COPD, COVID, and clean air pollution. So I'm going to go over a tiny bit about what I'm going to talk about today. You'll see everything fleshed out in greater detail as I go through the presentation, but I'm going to do a brief overview of air pollution and lung health. You'll notice that some of my slides look a little bit like Renee's because I'm going to broadly speak about what she just talked about in really great depth. And then I'm going to give some examples of Chicago pollution impacts. And even if you don't live in Chicago, these are things you can think about laterally in the space where you live. We had a study that we did on the CTA bus routes, and then we're working on a project with our organization right now and looking at the impacts of diesel pollution on people's health. So that section is called Death by Diesel. Super uplifting for a Wednesday. And then also, I want to talk, I hate doing presentations without showing what solutions can look like. So I want to talk a little bit about what healthy communities can look like. And I also want to talk about, because my focus is advocacy, I want to talk about what we can do, what you can do if you want to be involved in changing the world and changing lung health for yourself and for others. So the first thing I want to talk about is some of the air pollution challenges that Illinois and Chicago face. a big part of them in the greater metro area, which includes 14 counties and over 9 million people. Some of the impacts that all of us see when we're out and about in the city of Chicago are the impacts of the fact that Chicago is one of the main freight rail hubs of North America. Not only is it one of the main freight rail hubs, it's also considered one of the largest inland ports in the city for diesel truck traffic. I grew up in Minnesota, so we used to have boats coming in the Duluth Harbor that carry things over the ocean. And some of that stuff happens on Lake Michigan as well. But our primary point of impacts are trains that come through and heavy duty diesel trucks, 18-wheelers and semis that come through the city of Chicago and all the roads that are near where we live. So the economy is primary, and transportation and industry are massive in the greater Chicago area. Our air pollution history is a little disappointing. Chicago has not met any of the US air quality health standards since the 1970s. That was when they were established. So in case you got excited for a minute and were like, oh, wow, well, it's so great that we did good before the 70s. No, that's actually when the metrics were established. And ever since they have been established, the Chicago metro area has not met those standards for ozone or particulate matter. In summer of 2020, we saw 20 days of unhealthy air. Those of you who have experienced the summer and the wildfires and air pollution are starting to see what that category means when we see that little that thing that looks like a little speedometer that the EPA puts out that shows us the air quality. In 2020, there were 20 days of the unhealthy air. And once we look at the numbers for this summer, I wouldn't be surprised if we pass that. Our biggest air quality issues are, like I said, PM 2.5, which is particulate matter. I'm going to get into that a little bit, and something called ozone. So what is ozone? A lot of us think of ozone as like the thing that protects us from burning alive from the sun. That is true. However, what I'm talking about in this slide and what is relevant when we talk about air pollution is something called ground level ozone, which is also called smog. Basically, ground level ozone are organic chemical fumes and gases from burning fuels, like when your car makes exhaust, or when power plants or industry make exhaust. Those chemicals are cooked together in the sunlight and they form ozone. The other part of what we're facing here in this area is fine particulate matter, which is also called soot. And soot is tiny little particles that are floating around through the air that are droplets and solids from vehicle exhaust, power plants, and smoke, like the stuff we've seen this summer from wildfires. The next slide shows a little bit of some of the issues that Renee was talking about. So ozone and PM 2.5, if you see my nice dude on the upper right and the picture of his lungs, you see his nasal cavity in his mouth and his trachea, and it goes down into his lungs, and there's a picture of a circle around the tiny, tiny blood vessels in the lungs. So PM10, which is not, it's a sort of larger format of air pollution. The larger the number, the larger the particle. So PM10 is under 10 micrograms. A human hair is 50 to 70 micrograms, so that's super tiny. And the stuff that we worry about most getting into our lungs from PM 2.5 is smaller than 2.5 micrograms, which is that teeny, tiny little period-sized dot under that picture of the human hair, which looks gigantic. So you can see why that's a big concern, because when you breathe in those particles, they can pass through the boundaries of your blood vessels and work their way into your body. Those particles are chemicals, smoke, pollution, and if they get into your body, they can cause a host of impacts. There's no level of air pollution that is a good level of air pollution. So even when you see your air now alerts, even when things are in healthy or moderate, any particulate matter in the air is going to be impactful to your lung health. And this is especially important if, like Renee talked about, you have asthma. It's also very important if you're impacted, like Ellen talked about, in terms of allergies. All this stuff can irritate your nasal passages and lungs and cause symptomatic problems that will be issues for you. Especially, like I said, the metric that makes up that little dial that I was telling you about is something that was decided by the federal governmental agencies that exist to protect us from air pollution. And what they do to set those levels is they meet with people like me who care about health, and they also meet with industry who often says, we can't do that, that's too hard. We can't control our pollution like that. And they meet in the middle. So if you're looking at that as a metric for protection, it's something that you also have to consider not to sort of keep lifting Renee up, but that's something you have to consider if you have asthma, that metric is something that was set by scientists, doctors, government, and industry. And even if it looks protective to the general public, it might not be protective enough for you to exist with that, whatever health condition you have, which is why it's important to support your health with the things that Renee was talking about in terms of figuring out what your peak flow is and making sure your medications are with you all the time if you suffer with asthma. That picture on the lower left is sort of a repeat of what Renee was talking about in terms of what a normal bronchiole looks like, and an asthmatic bronchiole. As you can see, it's swollen, it's got snot in it, and it's definitely harder to breathe from because of the stricture. So on the next slide, I have a list of the health effects of ozone and PM 2.5. You can have asthmatic episodes, you can have emergency department or ED visits, hospitalizations, heart attacks, premature deaths, you can lose days of work and school, you can take more medication, and you have more doctor's office visits. They've found that some of the health folks of particulate matter can also include things as varied as dementia and poor birth outcomes. So this pollution getting into your body and your systems is just not great. The next part is about asthma in Chicago. So around 200,000 adults in Chicago have asthma. The primary populations that have it more concentrated are darker blue on that map to the right. And the percentage of adults that's diagnosed with asthma is 44.1% Black adults and 29.9% white adults. In 2021, Black children between the ages of 5 and 19 are more than 4 times as likely to go to the emergency department for asthma as compared to white children. And we believe that such a health disparity shouldn't exist. Our health is also determined in part by access to social and economic opportunities, which is why in some communities, health disparities can be more evident because they're supported by the resources we have to take care of our health in terms of medical spaces and clinics, the quality of schooling and the proximity of workplaces, cleanliness of water, availability of food, cleanliness of air, and the kinds of social interactions and relationships we have. So those conditions in part explain why some Americans are healthier than other Americans aren't as healthy as they could be if they were given a different set of circumstances to live in. The next thing we're going to talk about is the impact of pollution. Some of the studies that we've worked on with Respiratory Health Association looking at some of the things that we're dealing with in the city of Chicago proper and in the Chicago metro area. First thing that we did was we did a study on Chicago buses. This was something where we looked at asthma and COPD rates, and we noticed that they are higher near major bus routes in the city of Chicago. And there are people that are living less than 500 meters of 7 major bus routes in Chicago, lots of people. And many CTA garages and high ridership routes are in areas that also have high levels of diesel freight and heavy duty truck pollution. This report's available on our website, but I can link it a little bit later too if anybody wants to see it. So one of the things we studied this back in 2020. One of the things that we looked at was what the rates of asthma and COPD were close to the high ridership routes. And along those high ridership routes, we found that asthma rates were 8.4% higher than average, and average being the rest of the average asthma rate in the city of Chicago. And the COPD rates were 10.5% higher than average in the city of Chicago. Near garages and facilities where the trucks, or it's not the trucks, the buses idle and wait to go back out on their routes, the asthma rate was 12% higher than average, and the COPD rate was 23.6% higher than average. And that map to the left shows that higher prevalence of asthma and COPD by tract with those high loadership routes and CTA garages. And that little chart at the bottom talks about where the most vulnerable routes are and the number of people that are impacted by those vulnerable bus routes. As you can see, those are often places where the other socioeconomic factors are coming into play. And like I said, those are other places where people are already inundated by heavy duty freight pollution and industrial pollution. So beyond asthma and COPD, like I was saying, that just looked at bus emissions and rates of asthma and COPD. It does not cover the geographic differences. It doesn't cover the already high asthma rates in those communities to begin with, as well as socioeconomic factors. It doesn't talk about the high concentration of people that live near roads, freight operations, et cetera. It doesn't include the toxic air pollution exposure, like I said, a diesel exhaust, which can cause neurological damage, cancer, birth defects, et cetera. And it doesn't include the health impacts of global warming that also come into play when we talk about these kinds of illnesses. Hotter urban areas mean less AC, mean more physiological stress, And one of the things that I think Renee mentioned, that stress can be a trigger for things like asthma and for exacerbations of illnesses like COPD. At the moment, the rate of pollution from transportation is greater than the rate of pollution that we receive from power plants, especially in Illinois. The next slide, I want to talk a little bit about what we've been looking at in terms of this death by diesel. And I know it's sort of a shocking title, but it is really toxic, diesel pollution. So I'm going to dive into that a little bit more with this next section that we're going to talk about. So we looked at some data that was published by the Clean Air Task Force, and we've created something called our Dirty Dozen report, which is also on the website. And so that PM 2.5, that tiny little period dot of pollution that can get really deep in your lungs, we found that in Illinois, the diesel pollution levels are 21% greater than the national levels, generally in Illinois. The state ranks 5th among all of the states in America with the highest number of deaths from particulate matter, that PM 2.5 diesel engine pollution per capita in 2023. In 2023, Illinois residents will account for 6.3% of asthma-related emergency department visits and 5.3% of non-fatal heart attacks because of diesel engine PM 2.5 air pollution nationwide. So our residents will account for a pretty large percentage when you look at states of those nationwide impacts, health impacts. As you see in the little chart on the right, we anticipate about 400, well, we didn't, the Clean Air Task Force did, but we pulled it together in the report. In Illinois, 416 deaths due to diesel pollution, almost 200 heart attacks, 264 episodes of acute bronchitis, almost 5,000 people with upper respiratory system symptoms, 3,300 with lower respiratory symptoms, emergency room visits, about 129 this year, and over 5,000 asthma exacerbations, as well as an increased cancer risk of 276 people per million. That's a lot. You know, that's a lot. So it's something that you can look at on the Clean Air Task Force website, and it's really interesting to break down by county each impact that we've seen. And of all the counties in Illinois, Cook County is in the top 1% of counties in America that has, with their level of diesel pollution, the top 1% of the country and impacts of diesel pollution. So we talked about that. I talked a little bit about it just now, but the significant health impacts of exposure come with societal and economic costs. Not just is it problematic to your health to have those respiratory impacts and other health impacts, but it also counts towards the money that could come to a family by missed school days, hospital visits, and healthcare. Monetized health damages in Illinois in 2023 projected for societal and economic problems are $4.6 billion. With almost 145,000 restricted activity days and almost 25,000 work loss days, which is huge, it's massive. An analysis of these data revealed that 12 of, which is why our report is called the Dirty Dozen Report, 12 of Illinois 102 counties rank in the top 9% of all US counties at the risk of health, societal, and economic impacts by diesel fine particle air pollution. Those percentiles were based on the PM 2.5 levels in comparison to all counties nationally. And RHA classifies our counties as the Dirty Dozen. As you can see, that Clean Air Task Force little map down there, those hot red spots are areas where pollution is worse. So it's something that we have a little bit of control over, which is what we're going to talk about in the What Can I Do section. So I don't want to leave you with some doom and gloom, which is why the next part of my slideshow is what we talk about when we talk about what healthy communities really could look like, right? And I don't think anyone needs me to tell them in this space that there are parts of Chicago that are definitely healthier than other parts of Chicago. These two maps break down the areas of Chicago in ranging from green to red, where the air quality matches up as the health index declines. Clearly, the redder it is, the more the health index declines. And that map on the right is from the city of Chicago in 2020. That map on the left is from an environmental nonprofit called the Natural Resources Defense Council, which was in 2018. And those maps look at those cumulative impacts of air pollution. So it isn't just that you live in an area where there's not great housing, there's a lot of traffic. It's that you live in an area where there's pile upon pile upon pile upon pile of things that can impact your health negatively. And if you think to yourself, well, I don't live there, I live in a place where it's a little bit nicer than that, then what you should also know is that all of us, because we live in a society where we pay into health systems and things like that, are impacted by other people's negative health impacts in the same systems that they operate in. So it's something that you should know. All right, The next slide is talking about how we can solve the problem: electrification of public transportation, policies that protect communities from industrial polluters. Those are some pictures around Chicago of the General Iron plant explosion in Lincoln Park, the Hillco explosion in Little Village, a diesel bus in the city of Chicago. So what can you do, right? This part is the part that's really, really, really important. Policy advances and the need for continued advocacy are huge. So the first bullet point: legislation was passed in 2018 approving the use of undesignated emergency asthma medications in schools, which is what they call stock albuterol. The bad news is the full implementation is just beginning 5 years after the law was passed. It's hard because as a person who does advocacy, sometimes we see things like this roll through the legislature. And if you saw that headline, you'd be like, yay, we passed this medication. It's going to help protect so many kids at school and in the parks and this and that and the other. But to know that it stagnated, it didn't get funded, it's only now, 5 years later, beginning the process of implementation is huge, right? So this is why we have to talk about continued advocacy for health benefits. The second one is one that I worked on, which is the Climate and Equitable Jobs Act, and was passed in September of 2021. That one work has just begun on the fraction of the bill's elements, and funding for implementation remains a concern. So we get all of the elected official support, we get really excited, we work, we form coalitions, we get together, we say, we did this, and then it relies on all the rest of the administrative and bureaucratic implementation processes to get to the hands of where it benefits people who live in the state of Illinois. The last one is that federally, the FDA is working to ban menthol cigarettes, which is really important because menthol is an additive to cigarettes that make them more appealing and easy to smoke. It's created a huge amount of health disparities in the African American or Black community because it's specifically marketed toward them, and it makes it harder to quit smoking and easier to continue being addicted to cigarettes. Other flavors of cigarettes were banned in 2009, and the process to ban menthol is still ongoing with no information about when a rule could be expected. So it feels disheartening, but I'm going to tell you next what we can do. So you get involved, right? Organizations are working on these issues, and we can always use more help. There's plenty of ways to help. There's calls to elected officials, there's sending an email, signing a petition, reach out to somebody like me. I'll tell you if there's things coming up. We've got stuff that we can take action on, that kind of thing. Reaching out to elected officials, but knowing which elected official to reach out to is really important, and I can help with that. To make sure that the voices of people who are impacted by lung health are loud and clear in every district, we need more advocates in districts of all levels of elected officials around the state and in Congress to take action and be loud about this stuff. And accountability is huge, right? Like, we've had a lot of conversations about how to get people in office and how to make sure that the people that we support stay in office. But the biggest thing I want you all to take away here is that accountability is critical, right? Can you even imagine hiring a person for a job and then saying to them, good luck, please do your job, I'll see you again in 2 to 4 years? That would never happen in any of the jobs that I've ever worked. And it should also never happen to an elected official. Accountability is huge. A lot of people make promises when they run for office that they never, ever, ever see the light of day when that person is actually holding office. So doing advocacy, being accountable, getting information from places like Rush, from RHA, about what's actually happening on the ground can help us all be better advocates as we move forward. And that is basically everything. I mean, everything that we can fit into a presentation, but this is the slide that I have. If anyone has questions, we'll handle them during the Q&A. That's my email address, knichols@resphealth.org, and that is my phone number. Although it's hard to hear it in the office, so feel free to email me and I'll follow up with you. But thank you, I appreciate it.
Thank you so much. Yes, well, I don't know where to start. You were talking about, Kelly, you were talking about, learning when you're hearing about the work of others, but you gave us so much to think about, and actually a lot to also to learn from the work that you're doing. First of all, thank you so much for your work and the work that the Respiratory Health Association is doing to prevent that more people then suffer or experience these respiratory issues that Renee and Ellen talked about, but also to eliminate the health disparities. As there's nothing more important that knowing that the loss of school and work days as well, then that exacerbates also the disparities as well. So Your work is phenomenal. We're gonna have also the website, which I think is RESP, so resthealth.org, right? Awesome. So I'll invite Renee and Ellen. I mean, there's a few questions that we have received, and bear with me because sometimes we get it in the YouTube channel, sometimes I get it in my phone via the chat. But let me start with you. I mean, also the ozone layer. I knew that the ozone layer was like in the stratosphere above us, but then there's this ground ozone that is just then around us.
Yeah, and when you check out those websites that tell you what the air quality is like, the airnow.gov website and some of the others, they'll also tell you which pollution is a problem in that moment. And like yesterday, because the wildfire smoke had sort of come through and was floating around, but then it was also really hot and really sunny. Up where I live in Highland Park, the bigger problem was ozone. And those two things actually feel different in your lungs. And I bet Renee could speak to this a lot better than I could, but they say that ozone feels like a sunburn on your lungs. And before I knew anything about air quality, I used to go for my runs, no matter what the air quality was and no matter what the weather was. And I would come home and my throat would be sore and my lungs would be just burning. And a lot of that is from that exposure to that pollutant that really can impact how your lungs react to it and can cause damage, especially if you already have a health problem, a chronic health problem like asthma or COPD.
Yeah, so actually, Renee, we have a question in the YouTube channel about the poor air quality. If it could cause, I imagine that it is a yes, because Kelly was describing something similar. Can it cause your blood pressure to rise? This person has not been diagnosed with asthma, but was outside during July 15th, a serious alert due to the haze from Canada. So apparently was feeling some symptoms.
Yeah, so that actually can happen because what happens is when your airways begin to bronchospasm, your heart begins to work faster to try to pump more oxygen to your lungs and your chest begins to burn. So it can increase the blood pressure. It's kind of your body's way of telling you there's something wrong, stop whatever you're doing. And something that I didn't mention for a lot of people who have COPD and asthma, when these are really poor quality air days, and I know everybody's sick of wearing masks because of COVID, but you do need to wear a mask or something over to try to help filter out those particulates. The hard part is because it's so hot, you really need to use one of the N95 masks to filter out those small particles, but it'll make a big difference when people are going out. And again, the air cools off. A lot of people, I can't tell you how many people I see with the poor air quality driving with the windows down in the car and the babies in the back seat. It's really important to make sure that because you can't see it always, but that scratchiness in your throat, the irritation in your lungs, that burning feeling that Kelly was just describing, your lungs are getting mad and they're starting to twitch and become irritable. And even people who don't have asthma or lung issues are noticing how bad their chest feels. I see people running all the time, and it's you really do have to be careful, because if we're doing it, if we had one bad air day, it wouldn't be that bad, but we've had multiple bad air days where you can't even see the Chicago skyline because the air is so thick, and they're out running, they're taking babies out and not thinking about it. You know, people who have severe COPD are still going to the grocery store and they're leaving the windows open and they're walking around. You really have to protect yourself and take that inhaler with you, because you never know when somebody who has a breathing condition, when it's going to flare up. So it can affect multiple parts of your body. Your chest hurts. You might feel nauseous, like you're going to throw up because you're working so hard to breathe. The blood pressure goes up. Your oxygen levels might go down a little bit. Some people get a little dizzy because they're breathing faster without even realizing that they're breathing short and fast due to the air quality. So I would definitely follow up with a physician.
Also, I can't remember whether you mentioned this or not, Renee, but it's also more impactful to the elderly and to children, because children have higher respirates and heart rates than normal healthy adults do. And elderly people also breathe more frequently, especially if they have bronchial issues to begin with. So it's even exacerbated. Like if you think, oh, my baby's a baby, it's no big deal. Well, no, that baby's heart is beating faster than our hearts beat, and that baby's breathing more frequently than we breathe. So that's something that has to be kept in mind too, as well, you know. And even if you don't see it, part of what I talk about every day in terms of policy change is that if we had a better baseline, like I said, we haven't met those national goals here in Chicago ever. If we had a better baseline, then when things roll through like wildfires, it wouldn't exacerbate what's happening in that baseline already. It would be an incident, an acute incident. But because of all the pollution that we have here systemically, it exacerbates what's already there and bumps it up even higher than it could in a place like the middle of a cornfield somewhere. Do you know what I mean? So that's something that I just want to make sure that people understand too.
And you presented the information about, you know, in Chicago, but then this is across the nation, you know. So we sometimes get some people outside of the Chicago area, and even Illinois, come to our lecture. So yes, check what kind of advocacy or you can do.
Yeah, and there's organizations like ours, but who like Renee was saying, ALA works nationally. The American Heart Association works nationally on these issues. CHEST works nationally on these issues. The airnow.gov thing, you can just plug in wherever zip code you are, and that'll tell you all about the air quality. The Clean Air Task Force is set in California, but they have data for all over the country on that Clean Air Task Force website. Like, it's not too difficult to find that information for the rest of the nation too, if you're interested in, if you are stymied by that. Anyone can reach out to me or probably anybody on this call and see where those resources are, and we can aim you in the right direction.
Thank you so much. Ellen, were you going to say something?
No, I think those are great responses. I'm learning a lot as well.
I know. Okay, well, before I go to two other questions that I have, I want to invite also our callers. This is the time for you to ask questions as well. And you, I think you're regulars, you know that you dial *6, and then you will be able to unmute for a question to our fabulous presenters. If not, then I'll go to two others that I got in terms of, one is actually for you, Dr. Stephen, the allergy shots. You describe the timeline at one point that is very regular. I think you said weekly, and then 3 to 5 years is very sporadically. So what happens to people who end the treatment prematurely?
Great question.
I don't know at which point, but prematurely.
Yeah. So the reason that we've settled on 3 to 5 years of treatment is that we've found if you're able to complete that length of a treatment, then the effect is more durable. So after finishing the 3 to 5 years, you can expect a longer symptom-free period, because basically what we're doing is retraining your immune system so it doesn't react as much against those triggers. We call that tolerance. It tolerates being exposed to the allergy triggers without as many symptoms. And that tolerance will be lost after a period of time, but usually that would be at least 10 years and sometimes much longer after finishing the treatment. But if you end prematurely, that could mean that your symptoms come back sooner, would be the concern.
Okay, thank you for that. Then the other one is in regards to, I don't think it's a question, it's more like a comment. You know, I think it was Renee who talked about asthma during menopause, like to develop asthma. I mean, it's like one more thing to add to the mix of menopause.
Yes, and it's not fair. We actually find a lot of women that come in that have developed asthma during menopause, and they're not exactly sure why. A lot of the studies performed, they don't actually know why it happens to this person and not to this person. They don't know if you're already predisposed to something. So they still need to do a lot more research in that area, but it's actually a lot more common than we know, like than you hear about. And most of these people who develop asthma in menopause never had any documented illnesses as a child that required breathing medication, you know, no chronic sinusitis, no recurrent pneumonia, no chronic bronchitis. They just don't know why it occurs, but some of the hormonal shift causes the airways to become hypersensitive, and they really can't explain why. But a lot of these women are like over 50 when it happens. Like they get minor symptoms in the perimenopausal phase, and then once they turn 50, and they know it's not COPD, they've managed to split that out. So it is asthma. Yeah, so they still need to do a lot more research on that. I found that very fascinating because it's like we get stuck with enough stuff.
Yes, tell me about it. But the bottom line is, yes, you start experiencing symptoms, any new symptoms.
Check with your
Hopefully
doctor.
you will have access to check with your doctor. And actually, one of the things that we do here in our department, Rush Generations, is brought to you from the Department of Social Work and Community Health here at Rush. And we have 1-800 toll-free number if you need access or guidance in terms of how to access primary care. You can always give us a call as well. The 1-800-757-0202 is not only for our programs, health promotion programs, but also about connecting you with resources like direct social care or direct social work. Well, I think that I'm going to let you go. Thank you so much for joining us. We'll add more information, some of the links that you have provided as well. We can send that, we can include that in our Facebook page as well. So that people are not only learning about, symptoms, treatment, prevention also. I'm glad that all of you touch on prevention as well. And sometimes that prevention is through advocacy. So please make sure that you equip yourself with a lot of information, resources, and that's why we're here for you as well. So hopefully you'll get some additional questions later on. Feel free to reach out to us at Rush Generations. Thank you, Kelly. Thank you, Renee. Thank you, Ellen. It's been our pleasure to have you today.
Thank you so much.
Thank you.
Thank you.
Thank you.
Let's see. And now I'm going to go through our upcoming programs. I think I have the correct. This is it. Fantastic. I'm going to close my camera as well, so that way we can take full benefit of this presentation. Once again, thank you not only to our presenters, but to our audience for joining us today. We are going to give you information. I don't know why it's not advancing. There you go. There you go. So I'm going to tell you about a couple of the programs that we have going on. You know some of them because you have either participated or we have let you know about them in the past. But one of them is the Health Legacy Program for Women, which was developed here at Rush. There you go. That way you can see it all. So it is a free 6-week workshop designed for women of color who are seeking to learn to eat right or to lose weight, to learn how to better manage their health, and who want to create a plan that improves the health and well-being of their family. And throughout the 6 weeks is 12 sessions. It means twice a week. Participants learn about nutrition, healthy aging, coping skills to deal with the lifestyle changes they like to make. They exercise at the end of each session. It's a fabulous program and it has been well praised throughout the years. So don't postpone improving your health and the health of your loved ones. Call our toll-free number 1-800-757-0202 and we'll connect you with the Health Legacy Program staff. There's one coming up. Actually, this one in October, I think is going to be postponed so that we can accommodate a larger number of individuals, but nevertheless, give us a call today and we'll connect you with the staff. Then this program, which we are offering, we are able to offer it once a year. So a lot of people always ask about mindfulness one-on-one. In this program, in this class, participants get to learn and practice a series of simple mindfulness skills that can improve self-awareness, but also the ability to manage daily stress or cope with chronic conditions. It is a 4-week virtual class beginning on Friday, August 4th, so it's coming up. And it runs through August 25th. And the cost is $20 for those 4 classes. Of course, as you know, we always offer scholarships so that the fee is not a barrier to anyone. It is also offered via Zoom, like we're doing these lectures now. And if you are interested, please call it 1-800-757-0202. I wanted to mention also, because this program is offered, this class is offered by one of our wonderful clinicians here at Rush, Angela Lowerbeck. She's a doctor of acupuncture and Chinese medicine, and she has been at Rush University Medical Center for over 15 years. People adore her. She's an engaging speaker. She has authored book chapters, media articles, and is a compassionate provider who cares deeply about her work. So consider joining this class. You will be in for a treat. And then our next lecture is going to be in 2 weeks. So we know that the connection between the gut and the brain plays a key role in some medical conditions, as well as our overall health. So actually the gut is often called the body's second brain. So we will be discussing gut health at our next Rush Generations Health Education lecture on August 9th. So we hope that you join us and that you join our experts as they discuss the importance of digestive health and ways to improve it. And as always, we are here for you. Feel free to give us a call at 1-800-757-0202, and we'll be glad to connect you with people doing some of these wonderful health promotion and disease prevention programs, but also with other departments within, with other teams within the Department of Social Work and Community Health at Rush University Medical Center.